Okay, this artery is in the upper limb, and this is what is known as the anterior circumflex humeral artery. Anterior circumflex humeral artery. So for the anterior circumflex humeral artery, when you say circumflex, it's like something is cycling, is going around something. Okay, so anterior circumflex humeral artery, I have the picture here, very beautiful picture for you guys. So you should know that it's a small branch of the axillary artery, and it winds around the surgical neck of the humerus. So it supplies around the shoulder joint, and of course the muscles that are found there will be supplied to. So anatomy of this anterior circumflex humeral artery is like this. Origin arises from the third part of the axillary artery, that's distal to the pectoralis minor. Okay, we spoke about axillary artery and we said that axillary artery has 3 parts. Okay, I remember that. So it's usually smaller than the posterior circumflex humeral artery. Okay, so cause it passes laterally and anteriorly around the surgical neck of the humerus. Of course, it's anterior, so it's above. So it runs deep to the coracobrachialis and the short head of the biceps brachii, and cycles the humerus anteriorly to meet the posterior circumflex humeral artery. So branches, ascending branch supplies the head of the humerus and the shoulder joint, while the small muscular branches is basically the adjacent muscles. So it supplies the shoulder joints, supplies the head of the humerus, supplies some portions of the deltoid muscles, some portions of the coracobrachialis muscles, some portions of the biceps brachii muscles. So clinical significance. We learn about it because it's very important. If you are going to do any surgery around the shoulder joint, you should keep it in mind that what this artery, that's its territory, so you must pay homage. Okay, then you also learn about it because of collateral circulation. You also learn about the variation. Okay, so the size and the prominence can actually be different from one human being to another. Okay, so that's